features of the cervical vertebrae. So you'll notice, yes, it is very small, but they have a very large opening here, which is the vertebral foramen. If you can wear a vertebrae like a ring, you're wearing it through the vertebral foramen. And so that's where the spinal cord goes. You'll notice, though, in the cervical vertebrae that there's extra holes on the side. Those are the transverse foramina. Transverse means sides, so the foramen on the sides. You'll notice that the vertebral foramen is very large, and that's so the spinal cord can move through there. Well, all of them, the spinal cord moves through, but in the cervical ones, that's where you have the brachial plexus exiting, so you have more nerves going through that area, so it's quite large here. And on most cervical vertebrae, not all but most, you have a bifid or like a forked tongue spinous process. So that's going to be opposite side of the body. And so you can actually feel the spinous processes if you'll feel the back of your backbone, and that's all those little spiky things that when you bend down, you feel the back. So that's the spinous processes in the back or the posterior side. The anterior side, the thing on the front, is the body or the soma or the centrum. Okay, so we have the front and the back. And so that's the body, the spinous process. The things on the sides are the transverse processes, and that's where we find the transverse foramina. Okay, and so we see here these superior articular processes, and that's what articulates with the vertebrae above it. And then under the bottom, we have the inferior articular processes, and they kind of stack like folding chairs might stack. Okay, and so they're also very small, and they have, remember, a bifid spinous process.